So many people literally lost their homes from the fires.
And what was the first thing many landlords did? Raise rent.
You are now challenging our housing market even more. There is certainly the economic impact of it, which will contribute to our homelessness crisis if we don't do something proactively about it. If we just helped people get into housing, it's amazing the things that they're able to then do for themselves. But we also have to use the resources that we have well. Where are we spending this money? With whom? To what end? What are the measurable outcomes we have seen? Where are beds in each part of our county? Because we know homelessness touches all corners of Los Angeles County. And if those aren't the questions that we're asking, then we're asking the wrong questions.
You have a tough job, and you were on the LAHSA commission.
Yes.
Oh my!
Yes, I was for 2 years.
Was that fun?
There are phenomenally talented people inside an organization that I think is fundamentally broken. The bureaucracy that we have now created no longer makes sense, and we have to eliminate it. Right. We have to make it make sense. If you can't appreciate from a human level, you can certainly appreciate that it is far more cost effective to keep someone in the house that they're already in than to let them fall into homelessness. People who lost their jobs in the fires, helping someone, pay that rent check if they lost their job. If we don't figure out how to stem the flow of people falling into homelessness, we're never going to get out of this crisis.
On today's podcast, we are joined by Los Angeles County Supervisor Lindsey Horvath. We talk about homelessness, housing, and compassionate solutions that actually work. But first, we both have this really cool last name. Oh my gosh, I am so happy. I've wrestled with, I want to call it, Horvath interviewing Horvath. But that's probably only a podcast title I would like.
Well, it sounds a little boxing. I hope it's not so adversarial.
Yeah, that's true. We've got to work on a working title, right? It's on this side of the Mississippi, you don't run into a lot of Horvaths.
It's true. My family's from the Midwest. There are a lot of Horvaths back there. And I learned that in Hungary, Horvath is like Smith. It's very common.
You just stole my next sentence. You know what? I got to ask you something.
Okay.
Do you like polka music?
Of course.
You do?
I do.
Oh my gosh.
It's funny because I see on a lot of the millennial accounts on Instagram, thank God they taught us polka dancing and not how to do our taxes. But,
Really?
But yes, polka dancing.
Oh my God.
Very popular.
So my dad played drums in a polka band. He was an IBM test engineer.
Really?
And he played drums in a polka band.
Oh, that's incredible.
And he just I hate polka music.
Do you really?
Yeah. Oh my God. So I was that little kid behind the drummer, and I have fond memories of that.
That's good.
Yeah, very fond memories. I have, followed your career.
Okay.
For many, many years, since you were the mayor of West Hollywood. I just love the last name. And I was like, one of these days, I'm going to meet her.
Yeah, and here we are.
And here we are.
Amazing.
Thank you for spending time with me.
Thank you for the invitation.
You have a tough job.
Yeah.
A real tough job. Mm-hmm. And Los Angeles, with what's recently going on, gosh, I can't even imagine. And this is to all politicians.
Appreciate that. I appreciate that.
Yeah.
The county is a massive place. The county itself is more than 10 million people, but the county government is more than 30 departments, about 120,000 employees of the county of Los Angeles.
Wow.
We are the social safety net for the region. We cover a variety of topics, including homelessness, which I know we're going to talk about.
Of course.
And so many different areas in which the county gets involved potentially in someone's life. But in some of the most difficult and some of the most painful, and some of the most profoundly impactful ways, sometimes in wonderful ways and sometimes in really hard ways.
Yeah.
The weight of that, in addition to the work itself, but the weight of that is really what sits with me more than anything else.
Well, as I was waiting, because you had a meeting that was running late,
yeah, sorry.
I was like, no, perfectly fine. That's your gig. Mm-hmm. You know what I mean? You're in meetings and meetings and meetings, and some of them, I'm sure, get emotionally charged.
Oh, absolutely. I mean, when you're talking with people on any number of topics, our young people who are fighting for true justice, we've I've been speaking with state leaders about environmental impact that both cause the fires and now result from the fires. There's so much that's top of mind. And of course, really thinking about the crisis that I think everybody was thinking about before the fires was homelessness.
Right.
And not that it's, left anyone's mind. It's just compounded.
Right. And it's going to connect.
Yes, because so many people literally lost their homes.
I was using the example, for every $100 increase in median rent, homelessness increases by 9%. And so many people still want to blame homelessness on the person. It's their fault. They're a bum. They're a drug addict, instead of childhood trauma or racism or lack of a living wage or affordable housing. I use the example, we just lost a tremendous amount of housing stock.
Yeah.
And what was the first thing many landlords did? Raise rent.
I know. It's really scary. It's something we've been pushing back on, as I know, both from the price gouging perspective, trying to make sure that people understand there are laws that prohibit you from these exorbitant increases, and making sure that all of the mechanisms are in place to actually hold people accountable for that, are doing their job. But we were talking about this again before the fires. I'm a renter myself. The high cost of rent, even before the fires, matched with the fact that we know people aren't getting paid their value based on what it costs to live in Los Angeles. And it's incredibly challenging. And so, yes, I do understand, the American dream also came with a hard work ethic, but I don't think people aren't working hard. I think we are in a particularly challenged environment.
Yes, very much so. And it wasn't too long ago, we had this other crisis called COVID.
Yes.
And then we have this new crisis, and we have another crisis that's happening in Washington. And then, you also have automation. Yep. I believe we have a perfect storm of homelessness coming. Automation will create computer science jobs, which will be great and wonderful, but the entry-level job, there's a robot now that cleans toilets. So that entry-level job is going to disappear, and that is going to create more homelessness.
But I would also add the very human component of building community. Yeah. Going to your local coffee shop or, your local cafe, trying to replace that. There's nothing that replaces somebody knowing who you are, knowing maybe what cup of coffee you order in the morning. Yeah. There's nothing that replaces that. And those are the things that I hear most often from people who have been impacted by the fire. They're so sad, of course, about all that they've lost in their homes, but they're even more heartbroken about the memories that they created in community and with that being lost. And so there is certainly the economic impact of it, which will contribute to our homelessness crisis potentially if we don't do something proactively about it. Yeah. But there's just also that emotional toll that's taken with everything that we're losing.
And the county actually was seeing a little bit of a reduction.
We were.
Right, which, the point in time count fluctuates.
It does.
So it's at best a good guess, but at least it was a little bit better than the years before.
It shows we're going in the right direction. Right. And I think that new approach that we've had, working together, stop the finger pointing business and just get into, what is it that we need to be doing to get people off the streets and into housing.
Without your support, Invisible People's important work stops. Please visit invisiblepeople.tv/donate. We need you.
What is it that we need to be doing to get people off the streets and into housing?
And you were on the LAHSA commission.
Yes. Yes, I was for 2 years.
Was that fun?
It was very eye-opening, I have to say. So coming in to being a supervisor, I was of two minds. I could come in and say, to hell with LAHSA, it's over. I want to come in and end it. Yeah. Or I could put myself on it. Those really seem to me to be the only two responsible options, because just appointing another person and making it somebody else's problem, I think, is sort of how we got here. And so I decided to do the hard thing and put myself there and really see if there was a way that I thought I could, help to fundamentally change how people have experienced it, because it's just sort of been to me the target of everyone's ire. It's been used as, what everybody points to as the problem.
Right.
But if everybody identifies it as the problem, why is nobody jumping in to fix it? So I really felt that I needed to appoint myself, hold myself accountable to why people sent me to do this work, but also to see what was going on in there, to see how we could hopefully make some change.
Yeah. I was an outreach case manager here. I was a family case manager here. Especially when I was doing families, I was angry at LAHSA every day. Every day. The point that I'm trying to make was, then I saw a little bit behind the scenes.
Sure.
They're a giant bureaucracy.
Yeah.
And at the time, this is before H funding. So there was much less funding.
Yeah.
Right? You started off by saying, 88 communities?
88 cities plus unincorporated area.
Right, exactly. So LAHSA's responsibility to cover homelessness in this massive area, and they didn't have any staff back then, right? So, I'm a formerly homeless person, and we talk about lived experience, and I've seen best of both worlds because I, had a great job in the television industry, so I know how to tie a Windsor knot.
Okay.
And I know how to dumpster dive.
Sure.
Because I was homeless. And my point is that I saw both sides of LAHSA. There was, a huge amount of bureaucracy that I see when I'm at a homeless sweep, even today, that I want to scream at them. And then I look and this grew to this giant thing that's almost unmanageable and needs some extra love. Does that make sense?
Some extra something maybe. But yeah, no, I think there are phenomenally talented people inside an organization that I think is fundamentally broken.
Yeah.
And I think that's probably more frustrating for them than it is for me, because they're in that role. But to witness it, to see that there are good people who are trying to do good things, who are just stuck inside an organization that we all know isn't delivering what we want it to. Its governing commission is, 10 political appointees, 5 from the city, 5 from the county. But really what I witnessed firsthand was they cared more about the elected officials that they ultimately were answerable to, because they were in charge of the dollars that hopefully LAHSA got to do the work. And so the commission could say whatever it wanted, but ultimately if their appointers or the elected officials at the respective bodies had something to say, that's really what the LAHSA institution, gravitated towards in terms of how it would make change. And I get that because, like I said, because they got their funding from the city or from the county. So they have to respond to those concerns. But when you create a JPA, it's because you want to bring two organizations together.
What's a JPA?
Oh, it's a joint powers authority. Okay. So that's what LAHSA is.
Right.
So,
city and county.
Yeah, and it came actually out of a court decision having to do with street homelessness. When it was first created, it was to address a very specific issue and to formalize how the county and city work together. And since that time, it's sort of been like, well, why don't we have LAHSA do that? And as new things have come up, it's like, well, let's give that to LAHSA. Well, did we build out LAHSA to be able to handle that? Did we intentionally create an organization capable of handling everything we were giving to it?
And a big issue is the lack of affordable housing because you can't move people from the streets to shelter to a home when there's no housing stock.
That's right. And the affordable housing stock is incredibly limited. We're challenged in that way. And, we've also seen people get stuck. And so that's, one of the things that we track is how quickly do we help people get off the street and into housing temporarily. And then when we move from temporary to a permanent, that's the jump that always takes longer. And why, at the county, when we stood up Pathway Home, which is our encampment resolution program, we wanted to make sure that it wasn't just about getting somebody off the street to sort of be out of sight, out of mind, but really, how do we find that pathway home? How do we help make sure that when we're taking somebody off the street, we have a pathway for them to stay housed, whether it's because they get stabilized and they take responsibility, because they're able to, or if they need some additional support, that we actually have a housing solution for them.
And it's so important. And what happens, and this isn't a Los Angeles specific Pacific, it's wherever, is there's political pressure to get the housing numbers up.
Yeah.
So then all of a sudden you're just shoving people in boxes and the support isn't there. And people have to be able to thrive, not just survive.
That's right. That's right. And I think too, though, there's the very real world challenge of hiring into mental health positions and the cost of providing care and service. You know, I think in an ideal world, we would be standing up a system that provides care much like we think about sort of assisted living facilities. But we know those are expensive for the older adults who ultimately need them. And there's a reason, because the cost of care is very expensive.
Right.
So when we talk about what kind of system are we standing up, in an ideal world, we would do that. But we don't have the resources to do that for the people who have funding, let alone those who don't.
Right. And now there's going to be less housing stock. It's going to be very interesting. And there is a staffing shortage ever since COVID. I know many of the nonprofits have 40, 50 openings, which puts pressure on somebody else.
Yeah.
And, you know, would you want to go work outreach or be a social worker and you're screamed at, you're yelled at, you're spit at, have all this unappreciated, or go work at Target? And more people are choosing Target.
Well, and I think it's, you know, what are we paying people who come into these jobs? How are we setting them up to succeed? Are we training them? Are we standardizing the level of care that we expect them to provide? Are we helping manage expectations in terms of what they can and can't do? One of the things that I heard, even before I became a supervisor, I heard, you know, from friends who were in the Hollywood community, they would see, you know, different teams going out on different days to the same people. And they were like, why are there 4 different teams that go out here? And there are different teams for different needs. And so if you were a mental health focused team, you might not have all of the housing options that somebody might need, but because your focus is on providing a mental health service. From the outside looking in, it'd be like, why don't you just help this person? But from the bureaucratic process, it's like, nope, that's not what we do. We do this piece. But for a person who's already struggling to comprehend what is or isn't happening around them, to have 4 or 5 different people come talk to you about different aspects of your life instead of having just one person who helps walk you through that is incredibly challenging. And that's for people who have, you know, who are struggling with mental illness or potentially an addiction issue or other, you know, complicating factors. One of the things that really frustrates me about our circumstance right to this day is those who are newly unhoused, who might be in a circumstance where they can help themselves if they had the opportunity and access. There's not like a website or a phone number they can call and just say, you know, I've lost my housing. Where can I go tonight? There's no way that one human being can help themselves. All of the resources are gatekept by agencies, by service providers, and it's totally unacceptable. We are disempowering people. There are the people who criticize the homelessness services system, saying, you know, we have to empower people to get on their feet and help them. But we don't even provide them the platform to do it. We take away their agency almost as soon as they're unhoused.
I travel a lot, probably over 300 cities, 11 different countries now, mostly United States, lots in Canada. And I only know of one community, and that's Philadelphia, that has a 24/7 hotline where you can call outreach and they actually show up. I mean, not immediately, but they're there, you know, in a couple of hours. Most communities in America, you know, you call whatever, 311, 211, get the runaround, and it's lucky that they'll be there in 7 days. And at best they get put on a housing list, right? And it's crazy frustrating.
When I first came in, I had heard the challenges about 211. And when I met with representatives from 211, they shared with me that about 25%, nearly 1 in 4 phone calls that come into 211, they just simply didn't have the capacity to answer them. And it wasn't that they didn't know what to do or they didn't have a resource. They just never answered the call. And if that's the situation that we're in, we're not really setting ourselves up to succeed.
I have several 211 stories, but probably my favorite. So I worked the winter shelters. my job was to take the homeless families, and because it's a congregate shelter, it was the Glendale Winter Shelter.
Oh, okay.
And it was a congregate shelter. And, when a family shows up with kids, my job was to take them into a hotel.
Sure.
And 211 learned that I didn't turn off my phone. So, my shift was over at 9:00. I lived in Hollywood. I would drive to Hollywood, which is half an hour, 45, get some food, crawl into bed, and my phone would go off. Mm-hmm. And there's kids outside. And, I'm not going to get paid for it. And I'm not trying to pat myself on the back. I'm just trying to show how some 211 operators meant the best and were just being like Radar and MASH, right? Mm-hmm. Who's really flexible. So they knew this Mark Horvath guy, if they called at 1:00 and had kids outside, and I would go and I would grab the van from work and I would go and pick them up and I would take them to the hotel and I would, come back, and that went on for the longest period of time.
Yeah, you probably saved so many people.
No, it was a team,
It's always a team, but there's always somebody in there who cares enough to go that extra bit. So.
We just did a documentary on Hennepin County,
okay,
which took their COVID funds and they invested in eviction prevention, supportive housing, shelters, outreach, and created a community-wide system. And that is brilliant. Yeah. So we know how to solve homelessness.
Yeah.
We've known for a long time. We just lack the political and public will to make it happen.
We put more and more resources into a system that is challenged as it's currently designed to provide the housing and services that people need. Yeah. But if you think about how much money we're spending, if we just invested that in saying a certain percentage of people who, for whatever reason, just have trouble getting into stable housing on their own. Yeah. And if we helped them overcome that barrier, even by giving them a check through, some of our universal basic income programs that exist, but, let's say it's just
happening
housing.
Here?
Yeah, the county has universal basic income programs.
We've interviewed Mark Donovan, who is Denver's. I didn't know that it was happening here.
Yeah, so county has 2 programs. Some cities within the county and throughout Southern California have also adopted programs for different populations. If we just helped people get into housing, it's amazing the things that they're able to then do for themselves.
Right. You're talking about 211, and one of the things that I've been advocating for, we facilitate an online support group for homeless and formerly homeless people. It really started because of people we would get into housing, but service providers don't have the resources to be there all the time. So online, there's community, right? Anyways, where I'm going at is every homeless person has a cell phone. Mm-hmm. Almost the exact amount as housed people. Mm-hmm. The difference is they might not have electricity to charge it, but we could build something. You can go to Expedia and rent a hotel room anywhere in the world. Mm-hmm. As a homeless person, go in, fill out the forms. Mm-hmm. If there's services available, the big difference is in a hotel, somebody goes to the computer and says, oh, that person checked out. Mm-hmm. I mean, after this interview, we're checking out and the computer is updated, and we could do that. You could even do telemedicine over the phone. You could, basically people self-report. Mm-hmm. I know Hopic has where the public can report a homeless person, but just by the nature of homelessness, they move around a lot. Mm-hmm. You can update your location. There's so much that we could do.
Yes.
So we could replace 211.
Well, and the county is actually working on a platform to centralize the location of all of the beds that we're able to provide. And I was talking about this earlier with someone. Different departments all compete for the same beds. Yeah. And so one department might pay a different rate depending on what their bed is for. Yeah. So if it's an open bed and someone who is unhoused or someone who is being diverted from the justice system, if those 2 agencies are competing, the place that has the bed will wait to take the higher rate. If there's somebody at their door saying, I'm ready to take this bed now, and they think they'll get a higher rate if they wait a little bit longer because somebody else is going to come in from a different program, they'll wait. And that's also a challenge because this is when people start to not trust us. They hear that there are open, available beds that aren't being used. When we have an urgent state of emergency crisis on our streets, we have to figure out how we better use these resources.
Speaking of state of emergency, didn't you start that?
I did. You know, well, I will say the mayor started it in the city of Los Angeles for sure, and I, for the life of me, couldn't understand how the city could be in a state of emergency and not the county when we're so closely working together. And I came from a city that wasn't Los Angeles, and so looking at the issues that we see throughout the region, I was like, we absolutely have to declare this state of emergency to cut through bureaucracy. And you know, our director of human resources came up to me and said, thank you so much for doing this. This is something that we, you know, have really been struggling with how to navigate to, you know, hire people into the work faster.
And that's what the state of emergency allowed?
It allows for many things. That's one of them. So hiring mental health professionals faster. In fact, the Department of Mental Health has been the number one user of the state of emergency to hire up because we know we need more people in our mental health ranks. To hear that there are basic things like that are preventing people from getting hired into essential positions to provide these services, yes, I'm glad that the state of emergency is helping us cut through that, but we need to do that on a regular level too.
Oh my gosh. So I enjoy talking to you, and this is the first time we've ever met. You'll see me online, off in LinkedIn now. That one of the pushbacks I get a lot because I always say, you know, there's so much broken in homeless services, and a lot of it is because of bureaucracy. And I get it. More money supposedly will fix it, but more money might not come. And some of this we could probably fix without more money.
I think you're right about that. I think, you know, it's clear to me that there are people, as we mentioned earlier, who are severely underpaid, and that either causes them to leave the work, which causes job vacancies, or prevents people from ever coming into it in the first place. So there's definitely a role for more resources, but we also have to use the resources that we have well. And that's just to have basic public trust, so people know that the dollars that they're giving us, because it's public dollars, it's their money, that the dollars that they're giving us to fix this problem, we're actually fixing it. And so, you know, my team always, you know, gets a kick out of how frustrated I get, I think. But if I see one more presentation on KPIs, you know, key performance indicators.
That one I know.
You know, I'm like, I don't want to see any more of that. I want to see, where are we spending this money? With whom? To what end? What are the measurable outcomes we have seen? You know, where are beds in each part of our county? Because we know homelessness touches all corners of Los Angeles County. And then what are we getting for those dollars? And if those aren't the questions that we're asking, then we're asking the wrong questions.
I have to clarify that, you know, more resources will always help. I'm not saying no to more resources.
No.
And in fact, you get people, they'll say, California is spending billions of dollars on homelessness, and homelessness is growing. And that's because of the affordable housing crisis, right? Los Angeles, both county and city, is housing more people than ever. More people than ever.
That's right.
LAHSA is housing more people every year than the year before, but they can't keep up with the new people entering into homelessness. That's why the billions of dollars in the budget are being spent, and you're seeing homelessness grow.
And that's why one of the areas, Measure A, which recently passed, is investing in homelessness prevention. Because if you can't care about people from a human level, I have lots of questions, but we know that there are some people who fit that bill, but they will understand dollars and cents. If you can't appreciate from a human level, you can certainly appreciate that it is far more cost effective to keep someone in the house that they're already in than to let them fall into homelessness and have that be required in order for them to start accessing support and services from the county or from any other government. And so from my vantage point, homelessness prevention, helping someone, pay that rent check if they lost their job, people who lost their jobs in the fires, people who, for no fault of their own, now are out of work. I think about somebody who might be a gardener. Yeah. They don't have an online portal to submit to say, please hire me. Yeah. Very rarely is that how they, pursue work. And yet some of the assistance programs require that you demonstrate that you're out there actively seeking work. We at the county had to find a way to help create assistance for people and protection for people so they're not falling into homelessness. Now, it is a temporary window. It's only for 6 months. But I brought forward this motion because people need to know that we understand they're going through a difficult time and we're here to help them. And we also created a fund to make sure that we are paying those housing providers to keep people in that housing. Because I understand if you are, a small landlord, small scale landlord, and this is your retirement plan, basically, which we know for some people it is, you can't just pay people to live in your housing. I understand that. Right. But we need them to be our partners in solving this crisis and not work against us. Because if we don't figure out how to stem the flow of people falling into homelessness, we're never going to get out of this crisis.
One of my pet peeves is prevention now has gone from being a conversation to being implemented. And if we had started prevention 15 years ago, 20 years ago, we would be in a much better place than we are today. What Hennepin County did that I thought was so interesting, they got a law passed that all the eviction notices has a county phone number that goes right to a department of lawyers that they immediately kick in to start doing negotiation between sheriffs and the landlord and everything else with the goal of keeping the person in the apartment, whether it's paying the rent for a short time or whatever is needed to mitigate the situation so they remain in housing.
Well, and Stay Housed LA is an organization that's helping to provide that legal support for people who are at risk of losing their housing. Yeah. But I've actually also talked with the courts. I spoke with our head judge, who's very interested in this topic. He knows I'm a renter, so we were talking about, what role can the courts play to incentivize property owners rather than to go through the eviction process, because it's long and it's costly. What if we found a way to get them money quicker? We sort of wipe the slate clean for people who are at risk of falling into homelessness, but we do provide them resource. So it's not like we're just asking them to forgive and forget. Yeah. Is there a process by which we can stand up a program at scale that really helps more numbers of people? And so they're open to that. And I think that's the kind of conversation, it's not just about finding dollars, because if all we're doing is funding, then we're just throwing money at a problem. Right. We need to be more strategic, more tactical, more collaborative. We have to, not just let all of these decisions be in silos, but instead bring them together. And that's why I proposed bringing a department to Los Angeles County that centralizes these services.
It's so hard because the nonprofits it's not conducive to collaboration because everybody's fighting for the same scraps. Yeah. I was in the room when Home for Good, United Way, got all the spas in a room to get them to all agree on coordinated entry, which was a miracle because everybody was arguing, I need this because I'm a veteran organization. I need this because I'm a youth organization. And they finally got everybody to agree, and coordinated entry started. The issue, coordinated entry works really good in theory, but not everybody has the same resources. Yeah. And that is why nonprofits just sometimes, they'll shake your hand at the gala and say, oh, you're doing a great job. And then they go back to their office and start fighting for the same scraps.
Yeah. Well, and we heard too, the mayor came in, very clear that coordinated entry system was not delivering as was intended, and I think I understand the history of creating that system was really to prevent what people were seeing in terms of housing providers saying, no, we don't want that person or that issue to be in our new housing, and being very discriminatory, not creating housing solutions for people who are living with a lot of challenges. And so the coordinated entry system was really designed to try and help solve that problem. So it might have come from a good place, but in practice, it's been a challenge at best.
Well, all this stuff comes from a good place. People have best of intentions.
Sure.
And layers of bureaucracy start because something happens. Somebody breaks a rule. Somebody takes too many gift cards, and somebody does something on a database, and another layer of bureaucracy and another layer of bureaucracy. It's all best intentions. And then you have this giant bureaucracy, and bureaucracy kills.
Yes.
The coordinated entry, I believe, what you said was the best of intentions, that somebody touches homeless services, and then the system would, there's an opening, and there's an opening. But the nonprofit either didn't have the resources to house that person, or often you see people cherry picking, or you have funders that say, here's $500,000, house one veteran, 2 people with mental illness, and 1 person with drug addiction. So you have to, skip everybody else. Otherwise, you're not going to fulfill the obligations of that grant funding to get more grant funding.
Well, and what we're really trying to do, especially the county, operates through an equity lens. So we're always looking at, where do we need to make the most impact? Where is there greatest need? And where has there been communities who have been historically under-resourced and discriminated against? And so we really try to look at all of those layers. You and I talk about bureaucracy and cutting through the bureaucracy because, we have to at this moment. It's pretty challenging. But I try to remind myself that bureaucracy was actually created to slow things down for a good reason, because sometimes people in power were moving so fast that the public never got a chance to weigh in and have their voice be heard. And so
we're seeing that play out now in a huge way in DC.
Absolutely. And so sometimes the bureaucracy is a good thing. Yeah. And I, as a Democrat, I try to remind myself of that. But when we think about such complex challenges as our homelessness crisis in Los Angeles, the bureaucracy that we have now created no longer makes sense. And we have to eliminate it. Right. We have to make it make sense.
We evolve. The world changes, community changes, cities change, people change.
It's true. And what was good at one time might not be good now. And conversely, I've often heard people say, at certain things that I brought up, we tried that, it didn't work. Well, maybe with the set of circumstances we're facing today, it's time to have a different kind of look at that idea.
So the fires were not too long ago. So everything is still in play in many different ways. What is the county doing so that we don't see a significant spike in homelessness? And I know that's a tough question. You might not have all the answers. Like I said, it's still in play.
Yeah. Well, there's so much happening. We immediately stood up emergency evacuation shelters for people. And thank God we had the American Red Cross join us in that effort to help stand up some beds and shelter for people who didn't have any other options. Right. We're now seeing people who know that this is, not going to resolve in the next couple of weeks. So they've sought out longer term housing solutions for those who have, had those resources. But for those who haven't, we had to close down the evacuation shelter that existed in West LA. And we worked to make sure that every person who remained there was connected with a housing solution. And that was important because we didn't want to be contributing to our homelessness crisis. Now, will they be forever in the housing solutions that we provided? Probably not. But we have given them resources and support to know that if they still want the support of the county, we will work to help make sure that they have that kind of support. But the other thing that is still happening is the homelessness crisis we already had. And now with homes being,
you took my next statement away again.
Well, it just goes to show we're thinking the same.
We're Horvath.
Exactly. With the reduced housing stock, we're now challenging our housing market even more. And so we have to make sure that we are accelerating our recovery process in a safe and healthy way, because we want people to come back to healthy, safe communities and a protected environment. But we also have to make sure that the places that aren't fire impacted are also growing too, because there's certainly a need for housing solutions. And we actually, through our district, are creating new housing solutions in the Valley and West LA, throughout the district with our partners at the VA, because there's definitely need. And so we are building and investing in housing solutions in all of our communities.
You were mayor of West Hollywood. How long ago?
I was mayor in 2015 and in 2020.
So you've seen homelessness at a 30,000 foot level. How's it changed?
I was telling the story earlier today that when I was on the city council in West Hollywood, we convened a study session actually with our county partners and others to talk about, what more we could be doing. And I want to say this was like 2017, 2018. And the representative for the supervisor at the time came and had a conversation. And we asked her, what more could we be doing to address the crisis? Because, we really want to solve this. We're serious about this. And she said, well, actually, the county needs to catch up to you. West Hollywood's doing a lot of great things. And it was nice to have the pat on the back, but frustrating to hear that there were solutions that we were providing that weren't already scaling at a regional level. And so I'm trying to take some of those lessons learned and do that. But I would also say, coming into what the homelessness services system is at this scale, we've said the word a lot, but the bureaucracy is quite the challenge. And so what I'm trying to do now is really make sense of it. Do you know that I think it's something like 14 different departments? The county has more than 30 departments, and 14 of them touch homelessness.
Oh, I'm
not
sure.
Just one, not even just a handful,
Right.
14. So if you're thinking about how do we stand up beds for people who are unhoused with mental illness, with substance use needs, with who might be justice involved, all these different things, and we're holding beds for different. We need to centralize how we are providing these resources. We just had a conversation in the county about the GR program, which is, provides a subsidy to people
General
who qualify.
relief.
Yes, for people who qualify every month. Right now, it's something like $221. Like nobody's living on that per month.
No.
Anywhere in America, let alone in Los Angeles. So, is there a better way to resource people who are receiving this support are receiving other services too, and they qualify for other things. But right now, all of those services are strewn throughout all of these departments. If we centralize this work and really understand how we are providing support to people, we will do exactly as you said, better use our resources to help make the impact for people that's actually going to make a difference, rather than making them go out and chase help at all of these different locations and hoping for the best that combination of services is going to make it work. We have to center the person who needs the help and wrap them in that help in order to make sure it's successful. And I saw how it worked in a small community with a much smaller population of unhoused people than certainly the county. But that truism remains the same. You have to center the experience of the person and match to what they need in order to see success.
How do you stay positive? Because you're positive, and I know what you just went through, right?
Yeah. I mean, it is incredibly heavy right now, to be honest. It's sort of where we started. There's so much work that we have to do, and the weight of the work is immense. But just the heaviness in people's hearts, to hold people who lost everything, who just needed a cry on your shoulder. I remember going to the West LA evacuation shelter, and they had a separate room for people's pets. And there was a young woman in there who was going in to check on her dog. And I had chatted with her a little bit. Her dog was so sweet. She asked me who I was, and I told her, and she just kind of burst into tears, and she was like, "Can you help me?" And she told me her story, and it was just more the human moment of who's going to be out there to help me. Who's going to see me as a person who is worthy of help and support? And so I think for me, the hopefulness is remembering that these are people. These aren't data points on a spreadsheet that we have to, somehow maneuver a balance sheet to demonstrate success. Every time you invest in a human being, getting off the street, getting clean, getting mental health support, you are helping them advance in their lives. And the work that they will then do for others, that's the blessing, that's the grace. And so if I'm able, with the doors that I can open, if I'm able to give access to someone, the result can be exponential if we really do that work. If everybody does their part, it's a lot easier load to carry. And I see so many people like you just keep showing up no matter what life has thrown at you. That gives me hope. You give me hope that you haven't given up with everything that you've experienced. I mean, how could I not have hope if you're out there still doing it?
Well, that was just a great story to end on, and I appreciate the kind words. I'm living proof that if you help somebody, right? Some people need a little more help. Everyone needs some kind of help. But if you just help your neighbor, if you just help your homeless neighbor, more often than not, they're going to restabilize their life. Mm-hmm. And I'm living proof that that's possible.
Congratulations.
Yeah.
I'm so proud of you. I'm so grateful for this time with you today. Thank you for the invitation.
Is there anything you'd like to add?
Just thank you. Thank you for doing this work. There's a lot that's happening in Los Angeles right now and a lot that's making people's hearts heavy. But I think this conversation, I think the ways that people have shown up for each other in this time, it's really heartwarming.
I believe we need to be very serious about the social crises that is hitting our country, that's hitting our county, that's hitting our city. But we have to share it in a way that there's hope that we can solve those crises.
That's right. That's absolutely right. Couldn't have said it better myself.